And Bipal, welcome to the HCM Awareness Day. Thank you so much for being here.
Thank you, Lisa, and thank you for having me today. And I really thank the HCM community and the HCMA for this great opportunity to discuss our hypertrophic cardiomyopathy program and also to raise more awareness about the HCM patients. We are located in Rochester, New York. So this is not Rochester, Minnesota. We are around 300 miles from New York City.
I do have some slides I can pop up. I think you sent me some slides, didn't you?
Yes.
Okay, let me put those up on. You can keep talking. I'll just do some back work here.
Okay.
There you go.
Okay, so we are in upstate New York, between Buffalo and Syracuse, and we are in the beautiful Finger Lakes area of New York State, and we are located in Rochester, New York, which is a medium-sized city. Rochester, we are part of Rochester Regional Health, and we have around 9 hospitals in the Rochester area, but also some in the St. Lawrence region in upstate New York. We have a big cardiology practice with around 50 cardiologists. I joined Rochester Regional in 2016, and my background is in cardiac imaging. So I do cardiac MRI, cardiac CT. I'm also the director of the Advanced Cardiac Imaging Program. And when I started out here, I felt the need to have a HCM program in this area. Many of our HCM patients had to travel more than 300 miles to get to a comprehensive HCM center. We also felt that we could improve care for our hypertrophic cardiomyopathy patients in this region. We started that program in 2018, and currently we follow around 350 patients with hypertrophic cardiomyopathy in this region. Lisa and the HCMA has been very good in guiding us through this process. And really helped us with raising awareness about this condition. HCMA visited us in early 2020 before the COVID pandemic, and we had very great feedback from them, and we've implemented a lot of changes to enhance patient experience. We've also been very lucky with Lisa's help to have Dr. Harry Lever mentor us over the past couple of years. I think we've had more than 50 sessions with him almost on a weekly basis to discuss all our cases. And I consider now Harry as a friend as well as a mentor. We provide all comprehensive services to patients with hypertrophic cardiomyopathy. We have a dedicated HCM line or number which patients can call in, or even if they want, they can email us. We have a dedicated scheduler so that we make the patient experience quite efficient, and the patients can have timely testing and appointments. We centralize our testing and appointments at our main location. So the MRI is on the first floor, we are on the 3rd floor, echoes on the 3rd floor, so they don't have to go to many different places in our hospital. All our stress testing, because stress testing is extremely important, especially to bring out symptoms, to evaluate for arrhythmias with exercise, and the most important thing, to bring out occult obstruction with exercise. All our stress testing is physician supervised. All our MRI is physician supervised. We have a dedicated hypertrophic cardiomyopathy nurse practitioner, Ludmila Kuchma. She's excellent. We have a dedicated genetic counselor. We encourage genetic testing in our patients with hypertrophic cardiomyopathy and families. So Kimberly Provenzano is our genetic counselor, and she does a fantastic job. We provide heart rhythm services with Dr. Chuprun. We have Dr. Chiran, who is a very experienced surgeon who does our myectomies. Our outcomes with myectomies have been excellent. And we have Dr. Jeremiah Depta, who provides alcohol septal ablation in selected patients. We partner with the Rochester Medical Center, Dr. Naidu, who's been also a great mentor to us for our advanced heart failure patients who may need cardiac transplantation evaluation. We also partner with Buffalo Children's Hospital for providing pediatric care to our patients. We do have IRB registry to monitor outcomes of all our patients with regards to mortality, with regards to outcomes with alcohol septal ablation, with regards to myomectomies. I also would like to thank Dr. Martinez, I know who's going to be speaking later today. We've had a couple of sessions with him, and he's been a great mentor. I know Dr. Macera from NYU, he's been very helpful, and also Dr. Weaver Pinzon, who's from Utah. We've talked on a couple of occasions. Finally, I would like to say that we try to provide very comprehensive, individualized care to patients with hypertrophic cardiomyopathy. As Lisa mentioned earlier, if you're having symptoms of shortness of breath, chest discomfort, lightheadedness, fatigue, you should bring it up to your primary care physician to see if you need to see a cardiologist. I have many patients who were labeled as having anxiety or asthma for a long period of time, but eventually found to have obstructive hypertrophic cardiomyopathy. If there's a murmur which is unexplained, that's another reason to seek a cardiology opinion. So again, thank you to Lisa. Thank you for the HCMA, and I'll also like to thank my patients.
Bipul, thank you so much. And I have to give a programming note here. We invited centers, if they wanted to come talk to us today, to take some time out of their day and join HCM Awareness Day with us. We did not choreograph or ask them to discuss any particular topic. We said, this is your 15 minutes. It's HCM Day. You're part of the community. Come share. But what just happened in the last 2-3 sessions, they each bring up something else that's really I think almost magical about the HCM community and HCM care. What you mentioned about, okay, we talked early on, the program was very tiny. You said, I want to do this. I said, I need care in that area for our community. We're going to help you make this work. So I said, I want you to meet some people. And I introduced you to Harry Lever. And then we made sure that you knew Dan Macera, and then you knew Hari Lever Hari Naidu. And we help build a support network for you and your team to learn clinically from those who know best. And not only did you establish better critical thinking about HCM management and technical skills on echo and imaging, but you've developed friendships and partnerships that will be lasting a lifetime for you professionally, while you're starting to develop this long-term relationship I spoke about with Sarah, about this longitudinal family thing. So you're one of the very few directors who's actually been in my office, because you came down to Jersey to meet with Matt Martinez to talk about, I think it was MRI or whatever, you were looking at an MRI machine at that point. So I think you just highlighted like my dream team concept. You have access to all of these physicians. They have access to you to care for families in your community that have family members in their community. We are really building a worldwide network where patients won't ever fall through the cracks again. So I thank you for your partnership.
Thank you. And I have to say, like every HCM specialist that I've interacted with via email or phone, I had a patient with Fabry's disease, so I needed to talk to the doctor in Memphis. Everybody's been very, very, very approachable via email, text. Most of the people give out their cell phone numbers. So it's a very close-knit community. And I'm really thankful, Lisa, for your help building that.